A couple of things. One is you want to be in a private place. You know, when you come to a therapist's office, you're in a private place by default. But when you're home, you want to make sure that you, or wherever you are, you want to make sure that you are in a place where you can focus and where you're not going to have distractions. So turn notifications off on your computer. Make sure that no one's going to be disturbing you, and really focus. I have a patient who told me recently that he always lights a candle next to his computer before we talk, which I didn't know because I couldn't see it, but I thought that was brilliant because he was able to kind of set that time aside. One thing I've realized when you go to a therapist's office, like there's a beginning and end. So you make an effort to drive there or take transportation there. You walk in and all of a sudden your treatment has begun. And at the end, you walk out the door and your treatment is ended and you have some time to decompress and to think about it. When you're at home or in your office, that delineation isn't as clear. And so I think making that delineation very clear, like, taking some time to turn off your computer afterwards and just kind of, think about, what did we talk about? What did I commit to changing? How can I do this? Is really important. From a technical point of view, I think that honestly, I've actually never asked anybody this, but I've noticed that I have some patients who use their cell phone versus using a computer or a tablet. And from my point of view, it makes it look very thin and makes them look small. But I would imagine that I think that that using a computer or tablet is a better option. That's just my gut. Simply because it's not something that you're playing games on and looking at Facebook on it. It's kind of you're able to kind of have that have that space. Also, I think that it's important to come in with an agenda, or come in with if you have something that you want to talk about, make sure that you have that written down and make sure that you're able to address that. I always try to ask that to my patients when we first start a session, whether it's in person or over video. But I think over video, it's even more important to make sure that that your needs are known, just because it's harder to get a sense about the person's nonverbal communication over video than it is in person. And so if somebody has something they want to talk about, I want them to address it as soon as possible. I always try to ask, but I also want them to know that. And it also structures the session and gives the session more structure. I always make an effort over video to make sure that our sessions are much more structured, simply because it makes it more comfortable. It makes the process go much easier. And I think people get more out of a structured session than they do of, hey, how's it going? And then kind of diving into wherever things go. So those are the general tips that I would give.